Good afternoon. I'm Steve Riorst, one of the Public Information Officers with the Watertown Area COVID Task Force. Thank you for joining us today for our media briefing. We have some great presenters today from the health field as well as the Chamber of Commerce today. So up first, we have Mayor Sarah Karen with a community update. Thank you.
Good afternoon. Today is Thursday, October 8th, 2020. In South Dakota today, we have 536 new cases reported, and that includes 7 probable cases, which is a new way that the state is using to report cases of COVID. In the state, we have 284 people hospitalized. That number seems to continue to rise, and we've had 272 deaths. 14 deaths were reported today. We have 171 active cases in Cottington County right now, and 385 active cases in our region. And since last week when we reported, we've had 111 new reported cases just in Cottington County alone. We all have varied feelings about the pandemic and the disruption that it's causing in our lives, and kind of seeing some patterns. We have those people who are saying, I'm just over it. And then we've got people that are saying, it's no big deal. And then you've got the folks that are saying, you can't tell me what to do. So we're all experiencing the stress that comes with COVID, and we all have choices. We can choose to wear masks, do the social distance, avoid large gatherings, and follow the isolation and quarantine guidelines. That's up to us. If you choose to follow those recommendations, you do so for various reasons. A lot of people do it for different things. Some people are doing it for their family. Some people are doing it to help protect our economy. Some people are doing it to try and keep life going on as much as normal as it can. Some are doing it to be able to be with family when the holidays roll around. Some of you might be doing it to protect the community or to show respect for other people. Maybe you're doing it because you have to be in your job, or maybe you want to get your job back, or maybe you want to travel, whatever. Everyone has their reasons. Everyone benefits from other people following the guidelines, so we need to be vigilant and do what we can to protect other people. So up next we have Dr. Dan Riefenberger. He is one of the COVID Task Force incident commanders. Dr. Dan?
Thank you. I wanted to talk today about some of the most frequent phone calls and questions that we get on a daily basis, just to try to get things out more, and so that knowledge can be taken in more by everybody. And really the only thing that has changed since March on everything with this on this pandemic is the volume of the number of patients who have this. If we can steer back to how we were disciplined in March to how we're doing now, when the volumes are so much more now, we could try cutting down on this. I know what our process at the clinic, nothing has changed from day one of what we have done. We still go through a screening process on patients when they come in the door. They're all screened, they're having their temperature taken. We do not mandate masks for multiple reasons as far as with it. One, I'm not going to have my staff be put in that position of getting into an argument with anybody. If they have a fever or they're having symptoms and they don't come in with a mask, they are handed a mask, and then depending on the severity of those symptoms, they are escorted to a room off to the side to end up being triaged further from there. But again, that process is still the same. We're doing everything else that we've otherwise had. If somebody is exposed to it, okay, we still have that 14-day self-quarantine that is out there, but there's a lot of variations that go on with that now. And part of that depends on that time of exposure that you are having to that individual. The other part with it is did the person who had tested positive for COVID and your exposure to them, were they wearing a mask? Was the person that was in contact with them, were they wearing a mask? Were they both wearing a mask? All of that can be taken into account as far as how many days that may come into play. The other part is if that individual who had the exposure is an essential worker and they're asymptomatic, they can still go to work, wear a mask, okay? But if you start developing any symptoms, that's it. You're tested, you're out until proven not as far as with it. So in that case, if nothing else, the masks are having a benefit because it could limit those number of days that you may actually be out. There are multiple ways to test. The most efficient and I will say the most that most patients like are the rapid tests because they can have an answer quickly. We had been waiting for months to get the kits for it. We've had the machines for years. That's how we run our quick strips and our influenza tests. But we couldn't get any of the test kits for COVID. Now we've got some. How long are they going to last? I don't know. Everything is an unknown as far as how quick or how fast we get replenished with it. But when we get it, we can have an answer in 15 minutes. Okay, the hospital still has access with it, and we can have a turnaround time on that within 2 hours. They have to have the supply along with it. They had a time where they were running out as well. Okay, we still have the option of sending into a bigger center, Avera, Sanford, or the Department of Health. That can be anywhere from a 2 to 6 day turnaround time. I'm with everybody else. Who wants to wait 2 to 6 days when we can have an answer in 15 minutes? We have to have the kits in order to do it, though. Who should otherwise be tested? The CDC is still not recommending that anybody that is asymptomatic get tested. Okay, there is an exception to that part of it as well. Individuals who are healthcare workers or residents in a communal living center or first responders that have known direct contact with laboratory-confirmed COVID-positive persons could be tested. Okay, the CDC updated their guidelines here at the end of August as well. If a person initially tests positive, retesting prior to returning to work is not necessary. We get the answer or question every day. When do I have to be retested to go back to work? My employer is saying I have to be retested in a week, and if it was positive, I go back again and get retested again. That is done. That is not a recommendation as far as with it. Unless illness required hospitalization, that individual can return to normal activities after the passage of 10 days from the onset of those symptoms and 24 hours without having any being fever-free without having to take anything for it. Testing is also not necessary if a person has been in close contact with laboratory-confirmed positive COVID case and they're asymptomatic, like I said earlier. Okay, they should still follow the social distancing guidelines, staying 6 feet away, wearing a mask if you're within that. I take my mask off when I'm up here. Everybody in this room up here, we're more than 6 feet away. These individuals should monitor for symptoms and get tested if needed, especially if initially to start with, if their employer is wanting them to have a test, even though they were asymptomatic but had exposure to somebody. If they were living with a vulnerable person, they had underlying health conditions, or they're a healthcare or essential worker. If a person has mild symptoms, the COVID testing can be necessary if the person lives with a vulnerable individual or a healthcare worker or a resident of a nursing home. Now, part of that also comes into play again in that quarantine aspect. Who is it you were exposed to? Was it your spouse or your kid, somebody that lives in the house with you? It's pretty hard to stay away from that type of exposure when it is in the house. Every year when we had influenza, I would never get it until somebody in my house had it, and then I would get it every single time. You can only go so far and on the exposure, but once it's in the house, you're going to have a hard time not getting it at that point. Other health issues that we're seeing. This is a time for allergies. People are coming in, the looks they get with the stuffy nose and the cough and everything else. It's not COVID. They have allergies. They may have a sinus infection. We're having a lot of strep throat. Strep throat and COVID can go together, just like every year when we have influenza and strep. Now we're just going to wait when influenza hits later, and we're going to get the trifecta. Are we going to have all three of them at the same time? Probably. We have to all keep that in mind, because treatment for strep we can have with an antibiotic, but the other are virus. We can't do anything different with that. And with that, we're still recommending that everybody still have their flu vaccines. And with that, I'm going to turn it over to Cindy Midland from Sanford, and she will talk about influenza vaccines.
Thank you, Dr. Dan. So we're going to talk about flu shots, something everybody loves to talk about, but very important. I'm going to refer to my notes quite a bit because I condensed it down. I don't want to miss anything. First, as we talk about flu shots in influenza, the terms are interchangeable. We're talking about influenza when we say the flu. We're not talking about the stomach flu. Stomach flu has been called that for years, even though it's not an influenza virus. I'm guessing it was probably just easier to say than gastroenteritis, so it just stuck, but totally different. So the flu or influenza is very different, and that's what we're going to talk about today. So who should get the flu vaccine? Everyone who is 6 months of age or older should get the flu vaccine every year, but especially this year. And how effective is it? It usually depends. It varies from season to season and several months ahead of time. They are doing forecasting as to what strains they think we are going to see that season. There's also some mutation of the virus that happens, so sometimes it's not a perfect match, but we still encourage it every year because it is your best bet against getting the flu and its complications. What's the difference between flu and COVID-19? That's the tough one because there's so many similarities. They both are contagious respiratory illnesses. They're caused by different viruses. Because some are similar, it's hard to tell the difference between the two just based on symptoms, and so quite often it requires a test to confirm the diagnosis. Some key differences between the two: COVID-19 is spread more easily than the flu and tends to cause more serious illnesses in some people. It also has some long-term effects that we're still learning about. It can also take longer before people show symptoms, and people can be contagious longer. And it is different for everyone. The important difference is that for influenza, there is a vaccine, and currently there is not a vaccine for COVID-19. We're working on it, but we're not there yet. So the best way to prevent infection for COVID-19 is to avoid exposure, like Dr. Dan talked about. As mentioned, some of the symptoms of COVID-19 and the flu are similar. They include fever or feeling feverish, chills, cough, shortness of breath, fatigue, tiredness, sore throat, runny or stuffy nose, body aches, muscle pain, headaches. Some may have some vomiting or diarrhea. Less common, more common in children than adults. A unique symptom of COVID-19 that you've probably heard before is a loss of taste or smell. Both COVID-19 and the flu can spread from person to person who are in close contact. You've heard a lot about that. We say generally within 6 feet, but there's discussion that it might be even further apart. Both are spread mostly by droplets made when people with the illness sneeze, cough, or talk near you. Both the flu virus and the virus that causes COVID-19 may spread to others even before that person is showing symptoms. And some people never develop symptoms at all. That happens a lot more often with the young. Both COVID-19 and the flu can result in similar complications, including worsening of chronic medical conditions you already have, pneumonia, respiratory failure, sepsis, cardiac problems, potentially organ failure, inflammation of the heart, brain or muscle tissues. Inflammation is an issue with COVID-19. However, most people who get the flu will recover in a few days to less than 2 weeks. So, if COVID is prevalent in the community, should you still get your flu shot? Absolutely. Getting a flu vaccine is an essential part of protecting your health and your family's health. You can get a flu shot at your clinic or local pharmacy. Why it's important this year is because we're learning that the efforts to reduce the spread means people are staying at home more, not always getting their routine preventative care. And so we want to remind and encourage people to get those things done, including getting your flu shot. So while the flu vaccine doesn't protect against COVID-19, it's important to get vaccinated, reduce the risk of getting the flu and its complications, keeps you healthy so that less likely to get something else. It also keeps us healthcare workers healthy and not have as many people, and we want to make sure we're always there to take care of you. If you have a confirmed case of COVID or suspect you have COVID, we don't recommend that you get the flu shot. It's not that you can't, but we don't want you to come in if you don't need to, until you are no longer contagious, because we don't want to spread it to healthcare workers and especially other patients. So contact your doctor about that if you have questions, or if you're not sure whether you think you should be getting the flu shot right now or waiting a little while. So your healthcare providers are all saying, let's get your flu shot. And no one loves to get a flu shot. Sometimes we give ourselves lots of reasons not to do it. It's human nature to avoid things we don't want to do. A long-running misconception of the flu shot is that it gives you the flu. It does not. It does not have a live virus. I think the confusion stems from the fact that sometimes you get some mild symptoms. It could be your body's response to, immune response to the shot, but more often than not, you probably have some other bug you would have gotten otherwise. But it's normal to think that that might be the cause and gives you an excuse not to get the flu shot. But that is not the case. Please get your flu shot. So while I admit it's not fun and you have to carve out time out of your schedule to do it, getting the flu shot is important every year, but we feel it is especially important this year. So please get your flu shot wherever it is that you go. With that, I'm going to turn it over to Tim Sheehan with the Watertown Chamber of Commerce.
Well, thank you, Cindy. As you know, my name is Tim Sheehan with the Watertown Area Chamber of Commerce, and as you may already know, over $400 million in CARES Act grant funds are available to South Dakota businesses, nonprofit organizations, and recent startup businesses. The Watertown Area Chamber of Commerce will host an informative seminar with the District 5 legislators, Hugh Bartles, Nancy York, and Senator Lee Schoenbeck, where they will present the information on the grants to be available to answer questions on those how to qualify, how to apply, and what the funds can be used for. The event will take place at the Heritage Theater located in the Watertown Event Center. The first session will begin at 3 p.m. for nonprofit businesses and organizations, and the second session will be for-profit businesses beginning at 4 p.m. Virtual sessions will be available on the Chamber of Commerce Facebook page and will be available after the event as well. Seating in the Heritage Theater will be limited to 30% of the theater capacity, and masks will be required in the facility until you find your socially distant seat. A few details about the process, which you'll find more about at the event, but eligible businesses must be located in South Dakota, of course, have had at least $50,000 in gross revenue in 2019, and have a reduction of 25% of gross revenue of business that year, compared to March of last year versus March of this year, or March through August. A reduction of your cash flow operations comparing to March 1st of 2020 from August 31st, or to August 31st, compared to the same time in 2019. And for that comparison, you are required to add the PPP money back into there for your 2020 income. A lot of questions we've had at the Chamber, and I don't have the answers yet. But basically, for the restricted startup guidelines, we don't have those yet, and we hope to have those available to us on Friday, and we should have those on our website as well. But applications are being written today as we speak to apply for those, and propose to be open to apply starting Monday, October 12th, and close on Friday, October 23rd. To reserve your seat to one of these sessions, contact Jerry at our office at coc@watertownsd.com, or by calling 886-5814. Questions to the presenters can be submitted to me, Tim, at watertownsd.com, and I will make sure to get those to the presenters to hope they can answer your questions ahead of time during the sessions. Oh, it's October 13th, I'm sorry. Next Tuesday, October 13th, 3 and 4 p.m. Very good, thank you.
All right, thank you everyone today. Mayor Karen, Dr. Dan, Cindy, and Tim for sharing all that great information with us. Appreciate everyone tuning in to get some updates from our community and how we can help work through the COVID here as well. And then at this time, that's it. I'll turn it over to the media if there are any questions. Any questions from the media today? Hearing that silence, I'm guessing there are no questions from the media. So thank you so much for joining us today. Next week, we'll meet at the same time when we're looking for an update, hopefully from the school district on what's happening there. So thank you, and we'll see you next week.